The Ministry of Health, Wellness and Elderly Affairs successfully convened its annual pre-Atlantic hurricane season preparedness meeting on Wednesday, May 21st, 2025. The session brought together heads of departments and key representatives from the ministry and various health institutions to assess the health sector's readiness for the 2025 Atlantic hurricane season. The interactive forum provided an opportunity for stakeholders to present updates on their disaster preparedness plans and identify ongoing challenges in health emergency response. Senior Medical Officer for Urgent Care and Disaster Management, Dr. Delphina Werner, underscored the importance of the hurricane preparedness meeting.
The purpose of this meeting is for us to look at the state of preparedness of the health sector as we begin the hurricane season. So we want to bring everyone on so we can have an idea of where we stand in terms of our infrastructure. We want to look at our communication. We want to look at our ability to manage our chronic patients. We want to look at things such as response, what happens when the disaster strikes. So we're looking at our coordination. It's very important for us to have these meetings before the start of the hurricane season, so everyone knows what their role is, what their responsibility is, and that in the event of a disaster, everyone can move as needed to help protect lives and ensure persons are safe. We can continue our health services as needed.
Dr. Sharon Belmar George, the Chief Medical Officer, stated that this hurricane season preparedness meeting is crucial for the efficient coordination of health services before, during, and after a hurricane.
Health services and the Ministry of Health, we play an integral role during disasters, from our preparation to ensure everything is in place before disaster. During, as essential services, we ensure that they are core facilities that remain open during the storm to ensure access to care during the storm. And also after the storm, we usually start off with satellite services that is within the community, but we also work very quickly to ensure that all of our facilities are up and running in a shorter period of time.
She noted that past events have underscored the need to strengthen mental health support, not just for healthcare workers, but also for community members who may face both physical and emotional challenges in the aftermath of a storm.
Learning from lessons in the past, there are some areas where we saw some gaps in our response that we are working to strengthen this year. One of them is to ensure care for the vulnerable populations, that is the homeless, the elderly, our patients with mental health issues. And we also have quite a few patients who are on oxygen concentrators at homes. This is always of concern to us in the event of an outage of the electricity, that those patients are able to get and have access to oxygen. So these are some of the areas.
The Senior Medical Officer for Urgent Care and Disaster Management outlined key action plans for various areas, including providing health services at shelters and utilizing educational tools to inform the public.
After we've convened this meeting, we have identified some of the needs, so we are going to attend to those. For example, we have facilities that remain open for 24 hours during a hurricane. For example, the urgent care facility, so we're looking at Grosley Polyclinic, Denry Hospital, Soufriere Hospital, and now Betty Wells Urban Polyclinic, in addition to our hospitals, St. Jude's Hospital, Millennium Heights Medical Complex, and Tapia Hospital. So we have looked at the state of preparedness of our facilities. What do we need to address? So those things to be done, and that includes things like water supplies, our generators, ensuring there's adequate fuel available. We have looked at our staffing and ensuring that we have set up our teams, and we're looking at all things coordination. How do we respond? Our radios, our backup systems available? How do we back up our patient data, our IT infrastructure? So there are lots of different aspects that all come together to ensure that the health sector is prepared.
The meeting forms part of the ministry's broader mandate to enhance disaster readiness across the health sector.